Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to use probiotics for bacterial vaginosis BV. Probiotics for bacterial vaginosis BV can help restore the balance of vaginal flora. BV is a common vaginal infection that affects more than 21 million women ages 14 to 49 years. It occurs when the unhealthy bacteria outweigh the healthy bacteria in the normal vaginal flora, microorganisms. /r/n/r/n. A strong fishy smelling vaginal discharge is the most common symptom of BV. Vaginal discharge also increases, and it is thin and, sometimes foamy, grey, greenish, yellow, or white. /r/n/r/nFizkes, Getty Imagesrnrn Probiotics are good, or beneficial, bacteria that naturally live in the body. They keep excess bad, or harmful, bacteria away and help maintain vaginal flora balance and health. /r/n/r/n. This article reviews why vaginal imbalances occur and how probiotics help maintain balance. It also discusses the best probiotics for bacterial vaginosis, dosage, and alternative treatment options. /r/n/r/n. A healthy vagina has a vaginal flora consisting of bacteria, yeast, and fungi. The good bacteria and vaginal discharge keep the vagina clean and infection-free. /r/n/r/n. Typically, the vagina's pH level, acidity, helps the good bacteria to survive. Vaginal imbalances occur when there is an overgrowth of harmful or unhealthy bacteria in the vagina. /r/n/r/n. Medications, diet, hormones, sexual activity, douching, and lifestyle factors can disrupt the balance. This creates an environment in which harmful bacteria can grow and cause bacterial vaginosis. /r/n/r/n. Sexual intercourse with a partner who has a penis is an example of how sexual activity can disrupt the pH level in the vagina. A pH of 3.8 to 5.0 is ideal for normal flora to thrive. /r/n/r/n. Semen has a pH level between 7.1 and 8. Having vaginal intercourse increases the risk of BV because the pH in sperm increases the pH in the vagina, making it easier for bacteria to grow. /r/n/r/n. Vaginal pH tests, or feminine screening kits, are available for at-home testing and are easy to use. You collect a vaginal discharge sample with either litmus paper or a vaginal swab. Once collected, you can compare your results with an easy-to-read pH color chart. /r/n/r/n. You can also buy at-home tests to check the balance of the vaginal flora. The collection is similar to pH tests. However, they are packaged and sent to a lab, so results aren't immediate. /r/n/r/n. Having pH levels above 4. The 5th of may indicate BV. In this case, contact your healthcare provider to get proper treatment. /r/n/r/n. Probiotics are good bacteria that are present in the following places. /r/n/r/n. Probiotics can help support your immune system, decrease inflammation, and digest food. Some studies show that probiotics help to restore the normal vaginal flora so that the bad bacteria don't outgrow the good bacteria. /r/n/r/n. Probiotics may also be helpful for certain people who get recurrent BV. If you are not getting enough probiotics in your diet, your healthcare provider may suggest supplements. /r/n/r/n. Probiotics naturally occur in fermented foods, such as :/r/n/r/n. The best probiotics for treating BV are lactobacilli-based probiotics such as Lactobacillus rhamnosus, Lactobacillus acidophilus, Lactobacillus fermentum, and Lactobacillus reuteri. /r/n/r/n. Lactobacilli play a key role in maintaining vaginal health. They produce lactic acid, which creates the acidic environment needed in the vagina. Certain types of lactobacilli are used in foods or in supplements, such as probiotics. /r/n/r/n The following are probiotics that are lactobacilli based. /r/n/r/n Probiotics for BV are most effective when taken by mouth. Vaginal administration is usually less effective. /r/n/r/n Probiotic supplements come in capsules, powders, wafers, liquids, and more. They also come in suppositories that you insert into the vagina. /r/n/r/n Probiotics have different strengths, ranging from 1 to 50 billion colony-forming units, CFUs. While there is no set dosage, the recommendation is for adults to start with probiotics with at least 1 billion CFUs. /r/n/r/n Talk with your healthcare provider to find out what dose and timing would work for you. The following are some common probiotic regimens that your healthcare provider may recommend. /r/n/r/n If you are taking antibiotics, your healthcare provider may also recommend taking probiotics 2 hours after the antibiotic. /r/n/r/n The length of time it takes for probiotics to work for BV varies based on the person and severity of BV. Whether the probiotics are taken along with antibiotics also makes a difference. /r/n/r/n Probiotics can start working within 5 days, but BV can take a couple of months to completely resolve, especially for those with recurring infections. /r/n/r/n You can use probiotics to help prevent BV. Probiotics can help keep the natural flora in the vagina balanced. This creates an environment where good bacteria thrive, which keeps bad bacteria from overgrowing. /r/n/r/n After your initial BV has been cured, taking probiotics may reduce your chances of BV returning by almost half. This effect may last for 1 month or more. /r/n/r/n Probiotics are considered safe for otherwise healthy people. Possible side effects include /r/n/r/n While the research is limited, some have shown possible harmful effects, such as infections for those with compromised immune systems or severe illnesses. /r/n/r/n BV is typically treated with one of the following antibiotics. /r/n/r/n Your healthcare provider may also consider. /r/n/r/n Your provider may prescribe these medications as pills taken by mouth or as a vaginal cream or gel. Sometimes healthcare providers prescribe both oral and vaginal medicines for you to take at the same time. This is especially true for recurring infections, those that come back repeatedly. /r/n/r/n Research has shown that when taken with antibiotics, probiotics are even more effective than either treatment alone. /r/n/r/n Bacterial vaginosis occurs when there is an imbalance in the normal flora of the vagina. Medications, diet, hormones, sexual activity, and more can cause an imbalance where the bad bacteria outgrow the good bacteria. /r/n/r/n Probiotics are good bacteria that can help restore balance in the vaginal flora. Lactobacilli-based probiotics are best for treating BV. There is no set dosage for probiotics, but the recommendation is that adults start with probiotic supplements with at least 1 billion colony-forming units, CFUs. /r/n/r/n Bacterial vaginosis is also treated with oral or vaginal antibiotics. Probiotics are often recommended in addition to these antibiotics to help fight recurring BV. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.